and that starts with chewing the food and swallowing the food and processing that food in the stomach, then into the small intestines, and then into the large intestines. And it goes through 30 feet of intestines, and at each stage, further breakdown is created so that we can digest the food and enjoy that food, both in terms of energy and both in a way of maintaining good health. And so I think people are starting to come to a certain awareness about the importance of nutrition, of eating well, of exercising, and of making sure that all these systems work well, and to actually check on these systems even when they're not giving you any problems. One of the big pushes out now is colon cancer screening. Everybody knows, or if you don't know, well, now's your time to know, that after 50 years old, and in some races and such as African Americans, you have to start at 45. And what we do is we actually have a very easy way to screen for colon cancer today. Everybody knows about the colonoscopy, and there are some other ways we can do it. And this is a very, very important push that the American Cancer Society and the AMA and everybody agrees should be done on a regular basis. And we believe very much in this preventative course of action.
Well, clearly this is what we have to, even though we don't like to hear after Yontif, certainly what to do and what to do correctly. But before you mention colonoscopy, before we get to the C word, okay, which brings with it, in my mind, a little dread, let me back up a little bit. When a person, as you had mentioned, puts something into their mouth, it starts a complicated and coordinated series and cascade of events. How does food get to the mouth? I mean, we all know how we chew, and we all know exactly, or we think we know exactly what happens over there, and we take big bites of whatever, and we break them down somewhat, and we mix them. How does food get into the stomach, Dr. Gettenberg? It just kind of plunges down? There's like a trap door there?
Hopefully we've brushed our teeth and we've gone to the dentist, and you have good teeth, and that starts the process of taking that food and you digest it up. And in the mouth we have saliva, which breaks down the food, and then the food is transmitted down to the esophagus, which is a complex organ that has a muscular structure that actually sends the food down through a process called peristalsis, which is the active motion and coordination of muscles that brings the food down to the stomach. And the esophagus is something that we don't really think much about. It doesn't get much press unless we have heartburn or other issues such as difficulty in swallowing. And then once it gets through the esophagus, it goes to the thick-walled stomach, which acts as a storage and a further digestive process.
Let me ask you this. I know that there's two pipes down there, and that's why we lean to the left, and so things don't get cut up. Why, in fact, doesn't all that food that you've chewed fall into what we call the windpipe or the trachea?
Right. Again, there's a complex series of events and coordination of muscles, starting with the tongue and the pharynx and the hypopharynx, which is the area in back of the tongue, going down. And when the windpipe is open, food is not transmitted, and then the epiglottis covers the windpipe, and then certain other muscles coordinate to push the food down into the food pipe and not into the esophagus, and not into the windpipe. So a complex...
And we do all this, I'm sorry, we do all this without thinking, mind you.
Right. This is what we call autonomic. It happens automatically, and only if there's unfortunately a problem such as in a stroke or other conditions this process is taken for granted. So it's a very complex series of events, and you really only notice it when something goes wrong.
Okay, that's certainly true. Let's assume it gets down into the stomach. I know that the stomach is wider. I know that there's different types of surgery people now try to do on the stomach to avoid gaining weight. What does the stomach do? The stomach's like a pouch, right?
Yeah, the stomach is a pouch. It has an amazing ability to expand and contract. Think about that huge meal you had on Sukkot, and you said, I'm not going to eat again, and then lo and behold, 2-3 hours later, you're eating again. And the stomach can expand, and we all know that we can put in actually more than we think we can. And then the stomach also has a process where it digests the food through a muscular contractions, and also the stomach is the area where acid, hydrochloric acid, which is very, very strong, is secreted into the stomach. The stomach has a thick wall and a thick mucus lining, and starts the process of digestion. Very interestingly, most medications and most foods are not absorbed in the stomach except for a few exceptions such as alcohol. Alcohol can be digested from the stomach. That's why its effects are maybe after Kiddush. You couldn't believe how quickly that single malt scotch affected you, but it absorbed through the stomach, and also aspirin can be absorbed through the stomach. Otherwise, the stomach starts in process of digestion.
You had mentioned that the stomach also secretes and contains hydrochloric acid. Isn't that the stuff that if you pour here onto the desk, it pours right through?
It may pour right through the desk, but lo and behold, that stomach, if everything is functioning well and you take care of yourself, it has all kinds of interesting mechanisms that protect it from that acid. And if these mechanisms of protection, we call them cytoprotection, or the protection of the skin of the stomach, if that's not working well, then you get breakdowns, which can be, you may hear your doctor mention the word gastritis, which is an inflammation of the stomach. A lot of people think it has to do with gas, but it doesn't. It has to do with the gastric juices and the gastric lining. And then another very common word that people hear is ulcers. Ulcers are actually breakdowns, or the beginning of breakdowns, which can lead to deeper breakdowns, which can lead to bleeding and actually making a hole through the stomach. These are things that happen when the normal protection, called the cytoprotection of the stomach, is no longer functioning properly. You know,
I'm sorry, doctor, those I presume would be somewhat painful. Say the ulcers, for example, they don't just kind of like jump up on you.
well, when we see them, and what we do is we do a lot of active investigation. This is areas which we look at every single day, many, many times in a very safe way called endoscopy. And we see those ulcers. And what's interesting is, although they may look angry and they look like they hurt, and only 50% of times do ulcers actually cause pain. So we may have people come to us who are actively bleeding, and they say, but I feel nothing. And then we have people who are in excruciating pain and can't sleep at night and have a terrible burning that may start in the front of the stomach and go to the back. So therefore, some people have pain and some people don't. It's another interesting variable that we're not sure why it happens.
Very interesting. What is the common, which I believe is a misnomer, the term heartburn? I've been told it has nothing to do with the heart, but it's still called heartburn. It's not called stomach burn.
Right. Well, one day we'll change that. That's a very, very, very interesting thing, and we see people every day with this very common complaint. And I like to say it comes from my teenage children who want to borrow the car in the middle of the night and do all kinds of things that teenage children should do, but make us parents very nervous. But the truth of the matter is that a certain amount of heartburn may not be anything to worry about. And heartburn is a very, very vague terminology that people use colloquially. That means that they describe something that they feel, a pain in the heart. And most of the time, people don't even point to their heart. But it could be anything like a burning or a discomfort or a bitter taste. And really, it's very important to speak to the patient, to speak to the person who's telling you about it, and ask them more details about it, because it's a very common thing that 50 or 60% of the people can suffer on a regular basis, and almost everybody has at some time. So it's a very interesting term, but as physicians, we look for something called alarm factors when people say there is heartburn. We ask them, is it something that you have once in a while? Is it coming more frequently? We also ask, is it something that you used to treat with a little bit of over-the-counter medication and now it's getting worse and it doesn't treat the same way? Are you losing your appetite? Are you losing weight? And so heartburn may not be such a serious thing if it's just coming once in a while and easily goes away. But if it develops certain other kind of factors, it's something that needs to be further evaluated.
I see. And how would you, is there a definitive way to differentiate that from a cardiac problem, for example, that might be, in fact, heralding some sort of catastrophe?
Well, I'm not trying to get out of it, but, we can do our best. Sometimes it's very hard to tell what we call esophageal or gastric or GI pain from cardiac pain. But the cardiologists are the first ones to evaluate that, because obviously somebody who's having angina or chest pain may be in a little bit more of a difficult predicament than somebody who's having some heartburn.